This is Greg Burt with the California Family Council, reporting here at the Capitol. We have a great guest I wanted to introduce you to today. This is Dr. Stephen Braatz. He is the OB-GYN from Northern California, and he's come to the Capitol to testify against a bill that's being introduced. It's called SB 24, regarding introducing a drug that induces abortions up to 10 weeks. And just a little bit about Dr. Braatz. He is retired from the Navy. He served both in Somalia and Iraq. He's a volunteer at Teen Challenge, and he also has some awards for his medical work in West Africa. So you have been around and done some great things, so we appreciate you being here at the Capitol. And so just wanted to you to explain something about these particular. It's called the abortion pill. Sometimes it's referred to as RU 486, and it's used to really induce a miscarriage on children up to 10 weeks. And so, if you could just describe to us a little bit about what the drug does and what it's used for.
Sure, Greg. It's a pleasure to meet you today, and pleasure to be here at the Capitol, representing life.
That's right.
Representing life. That's what it's all about. I've always been pro-life in my practice. I serve currently on the board of the American Association of Pro-Life Obstetricians and Gynecologists. Really proud to serve with that organization.
Yeah.
And our executive director, Donna Harrison, asked me if I could be here today. I'm more than happy to volunteer some time to come and talk about this bill.
Yeah.
Of course, we think abortion in our land is a tragedy in many ways. It doesn't respect the dignity of human life in the womb. It totally abrogates the responsibility that we as humans have, according to natural moral law, to nurture children, and nurturing begins in the womb. If there's anything we know from obstetrics, it's that nurturing begins in the womb. So we're against abortion of all forms, but this particular form of abortion, which we call medical abortion, using the abortion pill called mifeprex, mifepristone, or RU486, causes complications and can harm women. It actually has a much higher rate of heavy bleeding, need for surgical intervention, risk of infection compared to first trimester surgical abortion. And we think it's a bad choice for the state to be trying to require medical clinics on college campuses, to require them to offer this to patients.
Yeah.
The reasoning is supposed to be that it makes it more convenient for patients. But you know, when a patient takes an abortion pill, she's got to go to the clinic to get it. She's going to have hours or days of cramping and bleeding and possibly complications. Many women wind up going to an emergency room because they're bleeding. So that's not convenient for patients. This bill isn't going to achieve what they're trying to do in making abortion more convenient for patients, and actually is putting young women, college-age women, at risk.
Yeah. Yeah, if you see the bill being promoted in the legislature, they make it sound like it's as easy as taking Tylenol, you know. And what other misconceptions do people have about what this bill is and how it works?
Well, it's easy as taking Tylenol for the doctor who prescribes it, for the state who mandates it. It's not so easy for the patient. What she's about to go through after taking that pill. And that's one of the points we hope to talk about today. Other things about this bill is that, you know, it's requiring college and university health clinics to do a new procedure that they're not really prepared for. And the state can't just buy them an ultrasound machine and have them start doing ultrasounds on pregnant women without a lot of money invested into training new doctors and getting them up to speed on how to do that properly.
Yeah.
It's not as easy as they think. Also, there seems to be no provision in the bill at all for healthcare providers, doctors, nurses, who conscientiously object to participating in abortion procedures. It's not being addressed at all.
Oh, wow. Well, my goodness. Are there any other arguments you intend to bring up? I know that you're going to be testifying before I believe it's the Assembly Health Committee. Are there I know you're going to be testifying for about 6 minutes. Are there other arguments that you believe that, you know, they might be listening to, as you approach convincing these legislators not to vote for this?
Just want to make sure that they're aware of what they're doing if they pass this bill, that There are cases of patient deaths from taking this pill.
Yeah.
There's a many-fold increased risk of a certain type of infection, clostridial infection, that can happen with this pill. I want to make sure they know that this pill actually suppresses a woman's immune system, makes her vulnerable to infection.
Wow.
Along with the risks of bleeding and the need for surgical intervention.
Yeah. Well, so appreciate you coming today and giving your expert testimony. And for those who are concerned about this bill, it'll also be in the Assembly Education Committee in a couple weeks. So make sure you look up online. Make sure you look at who those members are, and make sure you give them a call. Make sure they know that you oppose this bill. So thanks so much. Appreciate you being here, and we'll sign it off for now. Thanks so much.